I'd like to open it up now to questions and answers from the audience. So if I could ask my friends Cliff on this aisle and Rick on the far aisle, and anyone who'd like to ask a question can make their way down to my two friends here and address the panel. And anyone from the panel may answer. Go ahead.
Hi, I just have a general question. There were a lot of questions around fears of increase in crime and drug dealers. And I'm wondering if anyone could speak to some of the benefits around decreased crimes in areas where there's SIS, or just to sort of give us more of a balanced approach so it's not such a fear-based discussion.
There's really only been one site in Canada that's been going for any length of time. That's called Insight, and in Vancouver. So you've heard about it. Everything else is really so new. And when Insight was established in 2003, it was established by a former police officer from Brantford, Ontario, Larry Campbell. And over time, you know, when the downtown east side is so unique, there's no place like it in Canada. It's the poorest postal code in Canada. It's a concentration of folks who have been traumatized throughout most of their lives, who are suffering through mental health and so on. But like Bryan said, you know, the Vancouver Police Department have been supportive all along the way, and you would see things even in the early days where if someone was injecting in public, they would drop them off at Insight. But Insight's a small facility. It sounds like this grand thing, but I mean, they were oversubscribed by the end of week one. I mean, there's simply no more capacity. So over time, you would hope that those harm reduction services like consumption sites have those links to other services, and when people get addiction treatment, or when they're using less problematically, using different substances, when there's alternatives that are appealing, when those protective factors are in place, like good housing, adequate income, and that kind of thing, then they're not breaking into your car and robbing your stores. So the health benefits from Insight, I mean, it was set up to reduce bloodborne diseases, which it has done, and it was set up to eliminate overdoses, which it has done, and it's had some other positive benefits as well.
Okay, thank you. On the side, Rick.
Hi, Karen. I was just curious about people that are sort of transients and they're using drugs and they're discarding the needles, which seems to be a fairly big problem. I'm just wondering if it seems like if you're handing out a needle to some transient, then when he does his drugs, then what's he going to do with that needle seems to be a bit of an issue, obviously, and obviously it's going to be thrown down. I was just thinking, is there a possibility, I have this one here, which is a disposable for putting needles in. I got a public health there last week. And I was just curious if there was something maybe a little bit better than this that might be somewhat in the same shape as that, but where you could open it up and have maybe your 3 or 5 needles on the one side, and on the other side then you'd have a place to dispose of the needles. And for transient people, this would be possibly an ideal thing to sort of have a place to carry your needles and a place to discard your needles at the same time. I'm just wondering if there's anything like that in the works or something we can look at getting creative. I can't seem to find anything on any sites that has such a thing.
Not to my knowledge. Right now, we receive our supplies through the Ontario Harm Reduction Association, and they're paid for by the province. But it's a good idea, and it's certainly something that we can certainly provide that information up. As you say, it provides a little bit more of an all-inclusive type of package with which to work with.
Thank you. Next one on your side, Rick.
First, I want to thank all of you for coming tonight, taking your time with a lot of information, and very helpful. My question is that Karen and Dennis, I would think, would have the answer. Karen, first, you mentioned that part of the assessment is going to be now, if it is decided that there is a need for a SIS site in Cambridge, that'll be a community. Community will get involved now. I'm assuming that includes the business community as well?
Yes, it would.
Okay. So Dennis, with you being in charge, I think, of the Mirror Task Force, Will you be part of that assessment?
Part of us looking at the community ambassador team would be, I mean, we've already been reaching out to businesses in the downtown cores and so on. So we would include those kind of things in our discussions as we look to expand our program.
Okay, so now going back to you, Karen, how do we ensure, and specifically, I'm talking about businesses in downtown Galt, because I'm very concerned. You know, I don't have an issue whether this is good or bad. My issue is about whether or not, what is the impact to the businesses in downtown Galt. In my opinion, I don't know if you're familiar with Galt, but Galt is already not as strong as it should be as a business core. We have a lot of empty stores, more empty stores in 10 blocks in Galt than there are in any of the cities that you mentioned tonight. So I have a concern. So what's the guarantee that these businesses are going to be consulted? And I don't mean just through the BIA. Actual businesses are going to be part of this process where we get a chance to say, here's what we're worried about.
There is specific rigor that's required for permanent sites that within a certain geographic distance, impacted businesses or homes or individuals would need to be part of that consultation process, part of the process to identify potential challenges, and then again, part of creating those solutions. And as well, we would also need a monitoring system to ensure that those things are in place. So first of all, we'll need to, if we do move ahead, a site would need to be located, and based on that, its immediate impact within, and I'm not sure exactly what that distance is, right around the area for assessment. So it's prescribed, or else our application doesn't go through.
Do we have
Thank you.
really
Sir, I'm going to cut you off because there are a number of other people who'd like to ask questions, but you'll have an opportunity to talk to them in the lobby. Cliff, on your side.
Hi, as a community member that lives close to the downtown core, I wonder if you can help me understand, for people who are using and injecting and whatever they're doing to get their high with an SIS site, what's the process for how long they're at that site? Because I know we've seen lots of completely high people coming up and down the street, disposing needles, crack pipes, all of that kind of thing. So as someone who lives here, I want to know what that's releasing into our community, what that's releasing into our schools that are close by, what the timelines are for that, and how that's being monitored.
Well, I can.
You want to start?
Sure.
Yeah.
No.
Are they being released high? Are they there until they're sober and clean? So then that's what I want to know. So if that's happening in the core of our community, in the places where we live, in the schools that are up the street, with children on playgrounds, and we're finding needles on playgrounds already, that's what I want to know. So if we're suddenly providing this safe opportunity for people, where's the harm reduction for us who are in this vicinity around these high people?
So, it's a great question, and the previous gentleman as well. I think it's. I mean, Karen spoke to it about the need to include business improvement associations and other folks who live here, like really serious. And the gentleman before him who brought up the little container, I mean, that's a great example of why needs to be an all hands on deck approach, because really great innovation often comes from places like this. So to your question around impact on business, before I get too deep into it, what we've seen across Canada is there are some business improvement associations. Vancouver's not the only place where they're advocating for treatment services, where they're supportive of consumption services, that kind of thing, because it reduces the disorder, because it has a potential to reduce crime in those kinds of communities. So more specifically to your question, I think what typically happens is people come into a consumption facility, they will use their drugs under supervision, and then there's often a place called like a chill out room, and it's not as nice as it might sound, but you're kind of observed there for a little while before you're discharged. I think it's also important to remember that unlike many of the other supervised consumption sites that exist in Waterloo region, that they're called taverns, they're called bars, they're called nightclubs. That observation period allows for some management of people who might be coming out high. But what's I think really critical to understand is for people who are addicted or dependent, it's a lot less about getting high than staving off withdrawal so you can feel normal, so you can go to work or feed the kids or whatever it is that you need to do. It's about stabilization of so you can function normally. So the short answer I think is people would use a facility, they would be observed, and then they leave on their own accord.
Okay. Sorry, just for clarity, Michael, on your point, they're observed until the risk of overdose is passed?
I believe that's the general idea. Yeah, they could leave right away as well.
Yeah,
okay.
Just to add to that, I think also behind part of your question is, and that's really a big unknown, hopefully addressed somewhat through the feasibility study, is will the pattern of some of those issues that you've raised be altered in a positive manner by such a service? Will it simply just sort of shift the issues slightly geographically one way or the other? Will they be significantly improved, or will they be potentially worsened? And I think so that's really impossible to predict, but the feasibility study hopefully will go a long way into making some really educated guesses about what that impact might be on some of those issues.
And I think the other piece, just to add to both of the speakers, is that the feasibility study will also look at what the now is. So as opposed to going to a supervised injection service, now they're injecting in the community, on the trails, in the public bathrooms, and there's no one monitoring them, and the highs are coming out on the streets. There is no oversight, and it's in the public arena right now, and this would take it into an area where people could be observed, and hopefully prevent some significant numbers of overdoses.
Thank you. Rick, on your side?
Thanks for coming tonight, everyone. Good to have you here. Just a question about, we've heard a lot about why we should have the site, the SIS, and really promoting it. But what about the downside? Question probably to Mr. Larkin. There's been quotes from different police chiefs and deputies and right across Canada that say SIS and the harm reduction is a good thing, it's working. But there's also a big downside, and we don't hear about that. I was just wondering if you can maybe elaborate on, with theft, crime, violence, are vulnerable, all that kind of stuff. We just don't hear a lot about sort of the bad stuff. We can all think I could tell you some stuff, but as a police chief, what do you see?
Well, I guess I may disappoint you on this one, but I'm trying to figure out what the downside is to what the challenges are we're facing right now in our community. 400 calls for service for overdoses, 65 deaths requiring police response. We see increased violent crime in the region of Waterloo. We see increased property crime in the region of Waterloo. And so what we're doing now is not working. We have to be honest with ourselves. The process isn't working. Our budgets are again, we're well resourced. The reality is, though, is that at some point we need more. We need more policing to deal with our current challenges, our current issues. Society's becoming more complex. So, our focus has not been, our focus has transitioned from addressing sort of the street user, the person that has a health addiction, and more focused on drug trafficking, illicit crime, and those that really prey on the vulnerable. Because most, regrettably, some of the individuals that potentially would use SIS have a larger challenges. It could be obviously concurrent disorders, etc. So I guess the reality is that the challenges we're facing right now require policing. And there is some evidence that potentially SIS reduces public order in some of the public pieces. So for example, across the region, we're just at about 6,500 calls for unwanted persons. And those calls relate to people going into the Tim Hortons washroom and using that as their injection site. So, you know, does that if we have an SIS site, does that reduce it? And so, again, I think that, you know, with anything, any public policy shift, there's trepidation, there's change. But if you look at, you know, in July of next year, we're going to legalize cannabis, and our concern is road safety. We're not opposed to legalization of cannabis, but that presents a whole other demand on policing. We're just currently keeping up with what we can right now from a policing perspective, not only in the region of Waterloo, but across Ontario, across Canada. Police resources have not grown with population over the last number of years for the first time in a long time. But that being said, we need to move the monies, and we need to move different pieces to other areas, to social services, to affordable housing, to address poverty. And so the downside of this, I mean, in reality is that, you know, I guess at some point, what do we have to lose? We already have a significant number of challenges, and so we have to balance that whole perspective. Hence why, from a policing perspective, you know, our feedback to public health on SIS is it's another tool in the toolbox. Is it going to be the solution? No, it's not the solution, but it is another tool in the toolbox to advance a different piece. So that's kind of where the mindset is. You know, when I converse with other chiefs, they're facing the same challenge, is that how do we balance what we're currently faced with? And I think we have some real challenges across the region, not just in Cambridge. Across the region, we have some realities that we have to face.
Thank you. Cliff, on your side?
Hi. Thanks for your time, guys. This question is for Chief Larkin, once again. My question is public safety. We asked you for a size of the immunity zone, I guess you can call it. I know in British Columbia, it's a 10-block radius. When they opened Insight, they hired 60 officers to act as a containment, not to enforce the law, not to go in that 10-block radius, but a containment. You just said yourself that our resources are maxed. How are we going to contain this in that immunity zone if we're already maxed? I've heard some of the numbers of what we run with on a shift for our police, and it's not a lot. So how are we going to deal with it once it's here?
Yeah, so thanks for the question. I mean, again, there's Vancouver Police reallocated officers, not necessarily increased staffing, right? So there's a reallocation, but it's difficult to say what the actual zone will be, because that's really based on the feasibility piece, and it's really based on a prescribed standard by federal legislation. And so at this point, you know, I can't guesstimate, and it also depends where it is, right? It also depends on some of the social factors and crime factors in those communities.
Do we have the resources to reallocate if need be?
Yeah,
or is this going to be a problem that's going to get out of hand once it arises, and then we're backpedaling?
It's a problem now, though, right? So I want to just let me finish for a second, please, and I'd be pleased to speak to you. But the reality is that we have significant challenges. We can't continue doing all the things that we're doing in policing, and so, you know, last week the Police Services Board authorized a 3-year operation plan where we're going to look at currently what our call demand and the things that we do. And we have to change the way we do business. There's a new Police Services Act that potentially will be new legislation which would potentially change the organization and the makeup of the organization. So I guess in short, do we have more resources now? I can tell you that Mayor Craig has asked me for more resources to be deployed to the City of Cambridge. It's not feasible without impacting programs elsewhere in the region. The Mayor of Kitchener has asked me for more resources. I don't have any resources to deploy to the City of Kitchener either. The rural townships have asked for more resources. I don't have more resources, but I think we need to look at it from a contextual perspective, and that's why it's important for policing to be at a table with social services, with public health, with crime prevention, is how do we look at the monies within the system are best allocated to solve the issues that we're facing. Because a police officer may not be the best individual to deal with some of the issues we're facing with. It may be better to invest more money in city bylaw to deal with some of those issues. And so I think we got to look at it from a very large level. It's not about adding more boots on the ground for policing, because it may not solve the issue. But in short, you know, we'll have to cross that. I mean, that's the precarious position we're in. And what does it look like? and how do we manage that? But right now, without cutting other programs, we don't have excess police waiting to actually come into other issues. We can't expand our drug branch. We've reorganized and reshuffled. So that's where we're going to do a large staffing plan. We would do a staffing impact assessment, and if we require resources, then we'd have to go through the board, through regional council to require resources.
Thank you. Rick, on your side?
Thank you, and thank you for coming tonight. Can you hear me? Okay. So I've been very vocal that I think the current model is broken, and tonight we've heard concerns, and there are concerns for those who use drugs and making sure that they don't overdose, saving lives, making sure HIV, there isn't an increase. But then there's also concerns about community safety. And so as Chief Larkin has said, this is a precarious position for police. It's a balancing act, and it's new. So a lot of the questions, you really don't have the information because it is new. It's new to the region. And so saving lives and keeping communities safe, but according to the health report that went to the region on the 5th, it says to improve community safety by decreasing public injecting discarded needles and no increase in drug-related crime. And I thought that was interesting because according to the information that I've read of other SIS sites, they still have needle litter. They're still having community or people who use drugs. They're still injecting outside. Only a small percentage will go inside. So you can't make those claims. You can't make that guarantee. And in terms of prostitution, I know what the concerns are, and especially with downtown cores. They don't want to see prostitution go up, thefts, break-ins, and in terms of swimming upstream, we're not even there yet. And so the real concern is how this will impact downtown cores. How will it keep our downtown core alive? And it says in that report, in that public report, it says no increase in drug-related crimes. So my question to Chief Larkin is, are you guaranteeing the citizens of Cambridge that there will not be an increase in drug-related crimes? Because that is what the report says.
Well, Cindy, I think that you know that I think you know that it's impossible to guarantee anything when you're dealing with social complex issues, and so no, it's not possible to do that. And the reality is that much of crime goes unreported across the region, across Ontario, across Canada. I mean, there is a large crime funnel. So those are some of the challenges that we face. And so, we don't have a crystal ball, but I will once again, sort of remind everyone that, we average about 17 deaths on our roadways across the region for the last 20 years in our region. And on every public survey, the biggest priority that I'm faced with is more enhancement of road safety. We've had 65 citizens in our region die. 65 year to date. We've had 14 die in road fatals, but nobody's called me to increase policing around drug enforcement and other pieces. And so I think, we need to shift the lens a little bit around this whole perspective and get a handle on it. And this is a national issue. I think it's something that every community is facing and every community is challenged with. And quite frankly, from a policing perspective, resources, not only locally, but in Ontario and across Canada, have never faced greater constraints. I mean, we just recently on Friday had a Supreme Court of Canada decision that says that we need a production order to access every text message now, even if you're a victim. That is going to create a significant impact on policing, a significant impact on the judicial system. And quite frankly, the judicial system is not equipped to deal with substance abuse. Our mental health court and our drug court can only deal with 10 clients at a time. That's the reality. There's great success, but it can only deal with 10 clients.
So I can appreciate that. But according to the report, we're told that these 3 areas, everything will be great, and that's simply not true. And the concern is if we got the other side, and so in terms of whether it's the city or whether it's the region or council, if you want people to understand what's going on, you just can't sell the one side. Yes, it's great. I don't want anyone to overdose or get AIDS. That's wonderful. But you also have to do the due diligence part of providing all of the information so that each person here can make an effort
to be informed. And so, like, even when when you apply federally for a permanent site, you have to give crime rates. And so I'm putting 2 and 2 together. If you're asking for crime rates, obviously that could be an issue. And so I would think that and I don't know where you live, but people who live in the downtown core really need to have all of the information so that they're prepared, and that they know going into this, they're fully informed.
It's a great question. I'm actually just looking at a recent systematic review of supervised consumption facilities across the world, and there actually is, on average, a neutral effect on crime. Now, we need to caveat that by saying most of that data is from very large urban centers. So a lot of it's from Vancouver, Sydney, Australia, and some scattering cities across Europe. And so from that data, there's no association with an increased crime rate or drug-related crime rate. Presumably, though, they would have different baseline rates of crime. And so again, the question will be one of relativity. Is the crime associated or potentially happening around a supervised injection site greater, the same as, lesser than the net crimes that were happening pre-site?
Thank you.
So,
sorry, ma'am.
Okay, that's fine.
We have other people who want to ask questions. Cliff, on your side.
Hi, thanks for coming tonight. I just wanted to kind of address the misconception, because you guys have had a lot of tough questions. I just wanted to address the misconception that the people who are not necessarily for or question safe injection sites are against harm reduction, and that simply is not true. We're just concerned about the public safety in our area. The residents of downtown Galt have seen a lot of increase in bad behavior from whoever, and so putting one of these in is just throwing up a lot of red flags. That being said, I just wanted to ask, if Insight has the detox center above, what are we doing to copy that if it's the best solution, or are we going to actually increase our detox center? Because from what my understanding, we only have one. So what are we actually doing? Is the province going to fund this, or are we just advocating for funding?
There has been a recent announcement that the provincial government is going to implement, I think, 2 rapid access clinics in Kitchener, Waterloo, and Cambridge area. There is already one that has just started in Guelph. And as well, there will be an additional significant amount of funding going into more long-term and supportive addictions treatment in the region as well. So they are trying to balance it out, because it's, as Chief Larkin said, an SIS site alone isn't going to solve the issue. It's a complex social issue, it's a public health issue, so we need a number of different items in the toolbox in order to be able to deal with it.
So what would the,
Thank you.
sorry, I just asked, what's the long-term look like? Because I think everybody's worried about that. What does the long-term solutions look like? You said there's funding for long-term solutions. What is that? The rapid access centers are a short-term solution. What's
no, long-term addiction treatment.
Okay, so what does that look like?
Well, it's an addiction treatment that deals with the it's kind of like if you're smoking and you quit. Some people can quit and just go cold turkey. They're successful, they walk away. Other people need to use some sort of nicotine replacement for a while. Some people go back and forth and back and forth. Or if you're dealing with alcohol, sometimes you need a peer to help you through it. So it depends on the individual, and you're going to need a number of different approaches to supporting people on a journey of conquering their addiction. So when I'm talking long term, for someone it may be a year or two, for someone it could be a lifetime.
Okay, I'm just going to add that we'll get to everyone's question who's in line right now, and there will be an opportunity to speak a little more informally with the panel in the lobby once we're done. So on your side, Cliff?
Yeah, my question, I guess, is with regards to well, upstream prevention, as you mentioned, number 20, and to our beginning panelist saying opportunity choice. And it's now everyone here has an investment in this core, especially or town, region, people or property, doesn't matter what it is, we all invest in this town. It's the 10th largest city, getting bigger. We need a forward-thinking plan, and the opportunity is now to place that plan in place. I've known family, friends, and foes that have gone down these routes. My biggest problem is it's not that people should be for and against. It's to look after our own and the people who are in this core or region. Like I said, it's the 10th largest, getting bigger. We're a rapid transit city now. You can now go down from Union Station to Galt Core. In a couple of years, what they're looking at doing and expanding. Not to say that we're the end of the line, might go further than that, but we're now a transit town. Traction to walking around, talking to users, homeless people, and known users. I've learned that the attraction to the Galt Core, especially from people out of town, and it's a lot of people from out of town, is the beauty place. Weird people, but we don't give questions to giving money. Makes us a hot spot. That's why we need to eliminate that. To be a hot spot, in order to have this succeed as a safe injection site, we have to have it in place for the people who need it here, not for people who are coming from out of town to use us as that place. Rapid transit, and like I said, it's our core to protect. Everybody protects cores. I know we're not no better than anybody else in this region, but that's why they call us a core. Cores keep things alive. City bylaws, I guess, are a concern for me. My question is to, what is our forward-thinking plan for in 10 years when we do become a big GTA regional town, and we're still stuck using almost archaic tools and practices that we are known that take time and resources? Why don't we just jump into being a forward-thinking town right away to kind of distract this problem, or deter this problem? One other comment, I guess, is a question, I guess, maybe to Mr. Purcell. If we do get a safe injection site, are we able to guide it as a core or a bylaw it properly, or is it regulated by whatever they say up in Ottawa? I guess my example would be, can we make sure that people that are local are using it, and if you're out of town, you know, kind of not too bad, so sorry, but making sure that our locals get access to it first. Also that to discourage outside of the, I guess, that safe zone you guys are talking about. A lady mentioned that you get people high and then let them out into the public. Determine that people that are coming from outside of town, once again, don't go out into the public, get off their high, want to break into something and come back and use the site. The opportunity issue is choice. We have a choice right now to do it right. We better get it right. A working model is known right now, i.e. Europe, so let's use the working models.
Okay. So I heard two questions in there. One is, what is our 10-year plan, and how are... No. Understand, sir. And also, how are we going to regulate the SIS site? Any takers?
So I think one thing I would make the comment too is that, as has already been mentioned a couple of times, that this isn't just a local City of Cambridge issue. This is a regional issue. This is a provincial issue. This is a national issue. So, is there made in Cambridge solutions? Not necessarily. Yeah. So what I was going to get at is, I think part of the reason why Mayor Craig pulled together this community task force was to bring together all these different agencies, to bring in community groups, and really bring people together to start to talk about these kind of issues. And I think through the use of that community task force and the subcommittees that have come out of that task force, dealing with public safety, dealing with social issues, dealing with advocacy, that it's really provided a forum. And you mentioned the term forward thinking. I would say that we are being forward thinking in some of these things. The community task force, the community ambassador program that we've got, some of the things that are starting to happen out of those things is forward thinking. And what's coming out of those things is there's a sharing of information. There's a sharing of different ways of approaching the problem, recognizing that it's not just about addiction and needle recovery and some of these things, that it touches on a whole slew of other social issues. And so I think the fact that all these groups are being brought together under Mayor Craig's community task force really gives the opportunity to be able to have these in-depth dialogues, to start to break down walls and not deal with these things in isolation, but to deal with it as a collective, as a community. And it really provides tremendous chances and opportunities, not only for the community to have a voice and to be able to say what the concerns are, but also for those who are working in those agencies to be able to provide that information. And there's a two-way dialogue that starts to happen so that we're not just relying on this agency or that agency or the police or the different levels of government, but we are coming together as a community. And we're working together as a community. And I think, as it's already been mentioned a couple of times, that it's not just the police's problem or the city's problem, it's all of our problems, and we need to work together. And so I think the community task force is taking a huge step forward in accomplishing some of those things. And it's going to give us the opportunity to look at future plans, 10-year plans, and even beyond that. And so I think we're on the right path. We're in the early stages of these kind of things, and I think there are some really good things starting to happen, and I have every confidence that there's going to be even greater things to come out of this. So we understand that people are concerned, that people have fears, that there's misinformation that is happening, and maybe the right information isn't getting out just yet, but there are tremendous things happening to rectify those things. And so I think we just need to continue to work forward, and as Chief Larkin mentioned, it's a matter of getting our mindsets changed a little bit and moving forward in a positive direction. Recognize we already have these problems. Let's try some of these things and let's see what we can do as a community to make a difference.
Thank you. Sir, I'm going to ask you to stop. We still have other questions to get to. Cliff, on your side.
Hi, I just wanted to thank the panel and also thank the Dunfield Theatre for letting us have this great space to gather. What I'm going to do is use a couple words that I've heard that is a problem now. We have very little information to evaluate against. We're still processing info. We're exploring options. We will be creating a response plan. So my concern is right now, the feasibility study is being conducted by public health as well as the police services. My concern is, where's our third-party review? Where are people coming in and consulting and looking at all the different people that are impacted? Is there a responsibility for us to reach out to a third party and not leave it at the local level? We have the federal government allowing us to make a public local decision and to gather this information this way. I believe it's a biased way to look at the information. It's not informing us on all the impacted studies globally and even within our own country. And one of the things that was said was that question 4 was, when are we going to review the community impact assessment? When are we going to reduce drug consumption? Neither of those questions have been addressed tonight. And in that, we've made a statement saying that we're going to be having a concern for mental health care and getting people off of using drugs. At no point have we discussed this to be a priority. The priority at this point is to reduce harm to users. Reduce harm was repeated numerous times tonight, and not to stop the consumption. So my question leaves it to be, our public findings, what we're using locally, is that going to warrant the implementation of an SIS unit?
Well, I think right now we've done extensive consultation. We've had a public survey. We have done consultation with people that could potentially use the site. At that point, we'll analyze it. It will go with a recommendation to whether or not there's an established need. And I think to jump ahead of that at this point is difficult, because it's one of these things where you've kind of got to go one step at a time. And if regional council determines that, based on the information of the feasibility study, that they feel there is a need, we are talking about the region, not just Cambridge. And so at that point, they will look at what process they want to use in terms of identifying locations. And then what the approach will be to begin to work with an agency that would operate the site. and then begin to put together the consultations to determine potential impact and identification of those challenges and a risk mitigation strategy to go with it.
I'd just like to add that one thing is I understand that process, but I'd like to know what phase 1 includes, who's involved in phase 1 assessment, and when phase 2 becomes implemented, what does that mean and what have we committed to?
So phase 1 was a in-person survey with people who inject substances. There were key informant interviews with a number of the service providers across the region. There was information and consultations with groups with a vested interest in the community response to the opioid crisis. And as well, we had a community-wide online survey. That's phase 1.
At phase 1, again, it's not reaching outside our current boundaries. It's still within our, our demographic of this community of regional Waterloo.
Correct.
So at phase 2, does this bring us into a new commitment where we've now investigated all the research and impacts that we need to, and now we're taking it into a permanent level?
So what that will also incorporate is the review of the literature, the review of the evidence, and the review of the experience to date. And that as well will be combined into the feasibility study summary report that council will receive.
Received all the information at this point. Again, I do appreciate the panel coming here, and again for the great facility, because I don't think we would have had the same turnout if we would have been locked in the a smaller space. So thank you again.
Rick, sorry.
Thank you. I noticed that the group's title is harm reduction, and you've spoken about the region of Waterloo over and over and over, and you've mentioned the surrounding areas, you've mentioned Cambridge, you've mentioned Kitchener, never once you've mentioned Waterloo. Now I don't know if that's a slip or a non-issue. That's one question. The other question I have is economics. It's a 3-part question. There was a 4-part one up there, so I guess I'm good for 3. Economics. We're talking a lot about fixing everything and providing this and providing that. At what point and who weighs the economical impact to the tax base? I just read a little piece that in Vancouver in 2002, the mayor was quoted as saying it was the east side was a crime pit that was costing $1 million a day. That's in 2002. So I know we're not Vancouver, but given everything that's relative, you just juggle it down and you can see where we're going. The stats are also that 1 in 10 people use an SIS, the balance don't go near it. And how much money are we going to dump into this facility when 1 in 10 are using it? And finally, I'll keep this one short. Given that you are into harm reduction, my huge concern is where is harm prevention, harm elimination, and rehabilitation strategy? I listened to John Neufeld of the House of Friendship the other day, and he was lamenting that he has 25 beds for men and women for the entire region, and to top it all off, other people from other communities use it too. What you're doing may be admirable. Really, all you're doing is making sure that the pin that's been pulled in the hand grenade doesn't allow it to go off. You're hanging on to the handle. It doesn't do anything for the people who are saying, look, I need to quit this thing. Where do I go? So as a taxpayer, I would much rather see 75, 80% of funds go towards rehab and the balance going towards this.
That's a great question, and I know that obviously we're talking about a supervised injection service, and so we have been discussing harm reduction extensively this evening. But thanks to the work of Michael, the Crime Prevention Council, the Police Service, and others, working with the integrated drug strategy in this region, that this is part of an integrated approach that includes work on prevention. We were at a meeting on that front just this afternoon. It does include recovery and rehabilitation. It does include justice and enforcement. And just to emphasize Brian's point earlier, that this specific service is not likely to move the needle on use rates, on perhaps not on access to other services. It's at its core a harm reduction intervention that is part of a regional strategy that includes primary prevention, upstream prevention, secondary prevention, and improved access to treatment. I would just point out on the cost effectiveness front, the cost associated, and this is again research that's been done mostly in larger centers because that's where most of these services have been provided until very recently. The cost savings of reduced infection in the drug injecting population are substantial, and so that's preventing lifelong infections like HIV and hepatitis C. And so actually the cost analysis comes out in the black, despite the fact that you're putting in upfront costs, infrastructure costs, public health costs, and potentially changes to other costs. The net sum, primarily due to the reduced infectious disease transmission, ends up typically being or estimated to being positive.
I understand. So all you're trying to do is hang on to its leash. That money that you're claiming that is a cost saving, how much of that are you going to pour into rehabilitation? Because what's the good chasing these people around? And now the government is a drug dealer, right? Casinos, if you go into a casino today and you claim that you're a gambling addict, cut me off, you can't get in, right? Here the government is now going to be handing out needles, and I think actually maybe even wisely they should hand out fentanyl-free drugs. If you're gonna get half pregnant, you might as well have the baby, right? So my concern is for the people also that want to quit. We don't have the facility, and who among you are addressing that, if anybody?
Okay.
Well,
Clint?
Sorry.
Oh, sorry.
No. I think I had mentioned earlier, there was an announcement at House of Friendship, I'm going to say beginning of November, end of October, that did review the investment that the province is putting into a certain amount of rehab and addictions treatment services. So yes, we are behind in addictions and treatment services, absolutely, no dispute there. But it's not an exclusive situation. So we're trying to operate as many levers at one time in order to actually get some leverage and get some traction in the problem. And as many of the speakers have said, it's a polar approach. So you're working on prevention, you're working on treatment, you're working on enforcement and justice, but you're also working on harm reduction. And the evidence shows that by working in a comprehensive manner in that way, you maximize your ability to actually make an impact, because nothing done exclusively in one of those areas is going to work.
I could just say a
go
couple.
ahead, Michael.
Yeah, a couple things here. I mean, your point about economics, financial burden on taxpayers is well taken. I think it's frustrating for probably all of us up here as it is for you guys out there. And I really don't care whether if it's a regional budget, a municipal budget, a provincial budget, a federal budget. At the end of the day, taxpayers pay. And when you add it all up, there's a financial imperative to roll out initiatives in harm reduction and in treatment and in prevention. That phrase, an ounce of prevention is worth a pound of cure, like it really is true. And obviously we've missed the prevention boat. But I think it's true for people who in this region, not just at this table, but outside, who've been in addiction treatment for decades. They have been advocating relentlessly for improved capacity, for improved quality, and those are calls that have largely fallen on deaf ears, much as calls for upstream prevention have fallen on deaf ears, and sometimes harm reduction initiatives. So I think when I'm not an apologist for Jane Philpott, who happens to be a federal Liberal, but she happened to grow up around the corner where I did in Hespeler, and she puts out some really great quotes. And she urged Canadians to be bold, to be kind, and to be creative. And I think that's the value of people in this room, service providers in government, coming together. And let's think outside the box here, because the last 10, 20, 30 years have obviously not worked. It's a crisis that is at historical proportions. And, I don't know where he went, the person who asked the last question, but everyone in this room has a role to play. And I would say, finally, that, from my bird's eye view in working with other municipalities right across Canada, there's an exceptional opportunity that exists here in Cambridge that does not exist almost anywhere else. And that opportunity manifests itself in the Mayor's Task Force, in the kind of staff support that exists, and in folks at the Drug Strategy and Public Health and Police Services. I mean, this is the chief you want in your community, and he doesn't pay me to say that. So exceptional opportunity here, and there is, as you say, a financial imperative to get busy.
So I guess at the risk of sounding ridiculous, we live in a democracy. I'm glad we do. And in a democracy, we look towards science and statistics to develop legislation. And so all of these people have told us that statistically and scientifically, things like the safe injection site and the free needle exchanges make sense. And so unfortunately, whether that agrees with you or your morality, it can't be the issue when you develop legislation like this, because it affects us all. And the reason why I spoke out there, unfortunately, is because I hear often this term, these people. When in fact, these people are our mothers, our fathers, our sisters, brothers, nephews, and nieces. And you may say, well, look, they're not mine. Well, there you go. So maybe you think they're not yours, but let me tell you one other thing that statistics tell us, and that is that they may be yours and you just don't know. And if you don't know, and your mother or your father or your son or daughter is using IV drugs, I would hope that you would think that a clean needle would probably be the best way to do things. So another thing I want to talk about, as I heard you tiptoeing around the issue of heroin, pharmaceutical heroin, and prescribing heroin to chronically homeless, often on these drugs for 20 or 25 years. And one thing people get confused is that will be this system, or this system as it's used now is just given out to anybody, and that's not the case. It's like the worst case scenarios. But I've heard you tiptoe around that issue. And I thought maybe one of you, though somebody that's better suited to answer this question, can tell us how heroin can be both the problem and the solution. Like how can heroin be considered a pharmaceutical drug that's supposed to help and also be the cause of these problems? And I think a lot of people should know that, and I hope that you guys can answer that question.
Sure. Yes. Thanks very much, and I'd love to speak to you more about the details of some of the evidence around heroin substitution and providing heroin. And it's really a measure of stability. As you said, in some cases, heroin substitution is reserved for individuals that have tried, maybe tried methadone, maybe tried lots of different things that haven't worked. And there have been some amazing success stories in the ability of someone to get a reliable, clean source of drug at a regular basis. It's provided some stability in people's lives that they have never known or they haven't known for a very long time. And so I didn't want to go through that question of that was on the screen of whether we should analyze those, whether it's heroin or hydromorphone substitution therapy. There's some very exciting preliminary evidence that those are working really well. A crisis brings out innovation, and it's brought out innovation across all of these domains in the housing sector, in policing. It brings it out in health and treatment as well. And so the challenge beyond maybe this discussion we're having tonight is we've got lots of exciting emerging treatments, and what set of them are right for Waterloo region, what set of them are right for Cambridge, what set of them are right for Kitchener or Waterloo, and so I'd like to speak to you further about some of the evidence around that specific issue.
Thank you.
If I could just add.
Yes.
If I don't sound passionate about injectable opioid agonist treatment or prescription hydromorphone programs, on the inside, I really am. I saw my first program at a hospital in England in 2007. It was Kent Police who took me there and said, you got to see this thing, it really works. And there's 30 years of evidence to back this stuff up in terms of dropping crime and, as Michael said, removing the chaos out of people's lives almost immediately. And in a Canadian black market that is very much toxic, I mean, I'm not sure you can get heroin on the streets anymore. Like, I'm quite serious. It's all contaminated with the fentanyls, and so it's exactly the kind of thing you'd want to do. And I think that's why the BC Ministry of Health has mandated their local health authorities to start rolling out those kind of programs within the next couple of months.
Okay, thank you, Rick.
Oh, I'm Bruce Nutter. Question here about the self-defeating or the expected benefits being undercut by your presumptions. I think in terms of, you said that if there is a need, then the SIS would be applied for and hopefully get on with it. At the same time, the question about where it would be located, oh well, it depends where the need is. But we all know that there is a need, from everything we've heard tonight, to deal with some of these issues. The question is, people here are concerned what the site might be. We all know there's a problem around the bridges, downtown Galt. I even heard it from a vendor at the market thinking that the business is bad because people don't want to go to Cambridge anymore, and that's somebody who lives outside of Cambridge. So there's a lot of issues about downtown Cambridge, and a lot of people presume tonight that the site might be here. So my question is, people that use the site have to go at least every day, probably several times a day. They're not going to commute by bus from Waterloo down to here. They're not going to go very far from where the site would be. So you're going to have a collection of people right around the site who are using, and may only be 10% of the population of the total drug users that you say might come to your site. And then you've got capacity issues that people want to come and won't be able to get in anyway. So they're going to cluster around. We don't have enough housing now at affordable rates to stop the crime of breaking in, because they still have to buy their drugs to get here to use them at your site. So the whole question seems to be, it's going to be a magnet to draw people in if they want to rationally use drugs, which I find a bit of a problem. And then it's only going to work if only a few people show up, because you don't have enough room for everybody if they all descended. So we know they won't all come. But those that do will need housing very close by. And we don't have enough housing now to meet the demand for low rental housing. So the whole issue, to me, you've got to have a lot more pieces in place before you jump in and do an SIS. I know the long-term plan sounds good, but I think immediately you're going to open up Pandora's box and your crime will go up. That's my concern.
think you hit the nail on the head in terms of the complexity. It is a highly, highly complex issue. It's related to many, many things, and what it's highlighting is areas of need in the community that need attention. I'm going to go back to Dennis's comment with regards to the mayor's task force and the ability to bring the right people into the room and start to really think out of the box and try and to think that, yes, I mean, SIS are one approach, but nothing's going to work in isolation. And so what are those components that also need to be in place in order to mitigate those challenges, to support it to be successful? Because I don't think anyone wants it to happen and fail. And you're absolutely right. It's complex. It impacts on housing. It impacts on access to other services. There are many, many things that need to be considered. And I think that those are going to be our challenge, to come up with a plan that we think is going to be doable and something we want to evaluate and try and continue to improve as we evaluate it. There's also going to be a overall organizing management structure of it. So it's not just going to be out there on its own, but it's not going to be an easy fix. And it's not going to be the only mechanism that we're going to use.
Thank you.
The joy of being last, I'm sure I'm going to repeat a lot of things that have already been said, and if I have my numbers incorrect, I apologize. An overdose every 7 hours. Our community had 65 deaths, which is less than 5% of Canada's whole issue. 30% of the users, I can't use the word client, I'm sorry, it seems to belittle it somehow. I'm a firm believer in if you build it, they will come. I think you might save some lives, which is fantastic. I don't think the numbers will go down because I think the people that use it will go up. So it might save the life, but I don't think your percentages will change. We've heard about vacancy and stuff downtown Galt. I've had the opportunity to walk, I believe it was called East Hastings Street in Vancouver. I'm not sure if that's the site we talk about, but when you walk that couple blocks, it's scary. The users are stacked like cordwood on the sidewalk for blocks. And if you're going to put this into a downtown core, good luck renting anything down there after that. Thank you.
Rick, go ahead. Last word.
I think maybe I'll be the last person if you don't mind. Just to sort of summarize a few things. Ms. Quigley-Hobbs, you sort of mentioned how complex it is. I know Mr. Parkinson...
Hold the mic to your mouth, Rick.
I'm sorry. I know Mr. Parkinson, we talked about the permanence of an SIS site. You sort of talked about, well, it's successful, but the problem is it's a Supreme Court ruling that because it's healthcare, if you put an SIS site in, you can't remove it. So I think the question is more like, if it's a failure, we have a problem. So my concern is, and you were talking about the benefits of treatment-based SISs, we're not faced with that choice here. We are faced with a choice of, we're going to put the SIS site in, and then afterwards, we'll do all these other things. And I think making this mutually exclusive does not work. Why aren't we considering all the aspects we need? So not just an SIS site, but the possibility of an alternative site, the possibility of not having a safe zone, the possibility of having more rehab, and to consider all those in your task force and in your analysis, and then come back with an answer that people can understand. But I'm worried that you're going to put the cart before the horse, you're going to do the SIS site, and then realize, oh, it's not working. We should have done this, this, and this. I know we're in a hurry because there's deaths, and that's a tragic thing that we're going through. But sometimes haste makes waste, and I'm very concerned that we're rushing into something that we may regret, and we need more oversight. And a lot of people feel that. Thank you.
All right. Any final
I'm only
comments?
used to like 5-part questions. So I think you're right. I mean, we have a drug strategy here in Waterloo Region. It has 99 recommendations, and there are people from the nonprofit world, there are citizens involved in it, there are institutions and levels of government who are involved with it. But that's not the whole story, and it pains me on a personal and professional level that in this municipality and others right across Ontario, across Canada, are forced to deal with an issue that was largely preventable, that was entirely predictable, and that is partly the result of other, sometimes orders of government or other agencies not really pulling their weight. I mean, let's face it here, that's how we got into this mess. And the point of that is not to be a Debbie Downer, no offense to Debbie's, but to say that you are correct. You really do need an integrated type solution here, and I don't think anyone here would disagree with you. I don't think anyone on this table, and I mean, Crime Prevention Council is not a proponent of this site per se, but would say that that is strictly, the responsibility of Waterloo Regional Public Health or Waterloo Region Police Services or the regional government, the City of Cambridge, that there are other stakeholders with a stake in this game that have an impact in downtown Galt or in Cambridge and beyond. And they're sometimes health funders, or sometimes other agencies of other orders of government. And I would encourage you to do what you can to impress upon them the need for more capacity in treatment, for better quality treatment, for expediting the initiatives that we know are proven to save lives, to reduce harm, to reduce crime, to improve and beautify downtown core areas or suburban areas, as the case may be. Point is, like Margaret Mead said, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And I thank you for your participation. I mean it wholeheartedly. I think we all do, for your participation and your interest. And yeah, it's not always perfect information. It's not always the right information. I think everyone on this table wants to see everything succeed, not just for Cambridge, but for the entire region, for the entire country, because it very much is a crisis. And yeah, I'll just stop right there. So thank you so much for your participation.
Thank you, Michael. All right, I want to thank everyone for your patience. We have run a little bit long, but I think the questions that we've had this evening are very important. And for those of you who still have questions to ask, our panel will be in the lobby after we're finished in here for a short time. And you, sir, and I think a couple of other people had some things you wanted to expand on. At this point, we have a very informal poll. I have two questions that I would like to ask all of you by a simple show of hands. The first question is, are you in favor of SIS in Cambridge? So if you are in favor, please raise your hand. All right. And if you are not in favor, please raise your hand. Okay, it would appear. That's a very important statement, ma'am, and thank you for sharing. Okay, so it was clearly, and again, this is informal, by a quick show of hands, it would seem that approximately 3/4 of you are not in favor of SIS. The second question that I have is, instead of SIS, do you support a treatment program where drugs are provided and drug dealers are cut out? If you are in favor of this, please raise your hand. That is as simple as the question is stated, sir. So, as simple as the question is stated, sir. Then don't raise your hand. That is the last question that I have for you. Well, clearly, sir, but we're trying to just get a sense of how people are feeling. We're not trying to answer all the questions here tonight. So, once again, I'll repeat the question. Instead of SIS, do you support a treatment program where drugs are provided and drug dealers are cut out? If yes, please raise your hand. All right, and if no, please raise your hand. Okay, and if you neither agree nor disagree, please raise your hand. Okay, it would seem a third all the way around. Thank you very much for that. At this point, I would like to introduce Mr. Dan Clements, who is the current chair of For a Better Cambridge. Please welcome Dan Clements.
Thanks, everybody. Thank you for coming. It's been a great meeting. It's good to have support. This is great. On behalf of all of us, some thank yous are in order. First of all, we want to thank the Dunfield Theater for helping us make this terrific venue available for this meeting. Thanks to Jason from Angus Audio in the back, who's been trying to keep track of whose microphone should be on and so on. And this beautiful, this huge screen and so on, they were involved in making all that happen. As soon as the city heard that we wanted to run this meeting, we've had their full support. And we want to thank the city for that. This meeting wouldn't be here tonight without their support. We'd also like to thank A Clean Cambridge, the citizens group, for their promotional support. Thanks to our moderator, Bill Kirby. And from a panelist standpoint, we know these panelists quite well. We've come to know, didn't know any of them like 6 months ago, but we've come to know them quite well. And when we were approaching them to be on the panel, one of our biggest concerns was, can they answer in 2 to 3 minutes? And they did pretty good, right? With the 2 to 3 minute, we said 2 to 3 minutes and no PowerPoint slides and so on. So that was all great. Please join me in thanking the panel. We really, you've made it. You didn't know what you were walking into, and we appreciate that. So thank you very much.
Thank you very much, Dan. And just a couple of final words from our Mayor of Cambridge, His Worship Doug Craig.
Well, ladies and gentlemen, it's been a long evening. I certainly appreciate the fact that so many people have come out, that the panel has come out, the expertise that they've provided. Two things come to mind. First of all, this is a community issue, and it's going to be solved not by me alone or by Chief Larkin or other individual members. It's going to be solved by the community and what you've done here tonight. And that's how we've gone through further crises that have happened in the past generations of floods, cholera that have happened in this city. That's how the communities reacted then. They worked together, and that's what we're doing here. With the SIS sites, we're still a long way off. I sit on the Board of Health at the region, and I just want to say that I have some concerns. I've asked two of our councillors, Councillor Mann, Councillor Montero, both ex-police officers, Councillor Mann, ex-deputy police chief, Councillor Montero on the streets for about 35 years as a sergeant. I've asked them to go off to look at SIS sites in various communities. I've asked them to look at what the community was like before the site came in, after it came in, what was the differences, talk to residents, talk to businesses, come back to Cambridge City Council and report to the public. So that's what we're heading for right now. But again, it's all of us working together that's going to solve this. And I have no plans on taking any steps backward in terms of my community and what I believe in and what's important to all of us. So thank you again for coming out.
All right. Once again, everybody, not to be repetitive, but you have all been a very important part of an important process in our community. And not to diminish any of the questions or ideas that people have wished to expand on tonight, because there are so many things to talk about tonight. It's all very important, and we do want to hear about it, either For a Better Cambridge or the members of our panel tonight. So that you know, I'm glad that you've all taken the time to stick around, because we have run a little bit late, but again, it was very important. Members of our panel, as well as our mayor, are going to be out in the lobby to speak with you informally, if you so wish. And if you would like a list of the questions and the answers, and perhaps some expanded answers on the questions that we had prescribed tonight, as well as a link to the video that we've made for tonight, you're very welcome to connect with us at our For a Better Cambridge table and provide your email address so that we can send these links to you. At this point, I would invite our panel and our mayor to proceed to the lobby, and once they've left the room, you can get up and follow them. Thank you very much, everyone.